Good afternoon, everyone. This is Andy Reese with Department on Disability Services. As always, I'll start by sharing our current data. So we do continue to see increased numbers of people contracting COVID, although there did seem to be quite a spike at the end of December, and my hope is that that's even actually starting to slow. But to date, we have had 580 people who have tested positive for COVID-19. There are actually five, if you add all of the little, if you add up every single month where we've reported it here, you can see we had 113 people test positive in December and 31 test positive in January. If you add them up across from the beginning of the pandemic, you'll come up with a total of 596 because we have had 16 people who have tested positive twice. 7 of these had a second diagnosis in December, and 7 of them had a second diagnosis in January. 2 are people who we had reported on previously.
Excuse me, Director Reese, your screen, is it sharing for everyone?
Thank you. Okay. So now you can see the spike in December, 113 people who tested positive. Thus far in January, we've had 31. Since December 1st, there were 143 new infections. Of these, 34 people were fully vaccinated. By the CDC current definition, which is if you were eligible for a booster, you had a booster, which was of the people who've reported, there were 22 who had had boosters and 12 who had had vaccinations recently enough that they weren't due for a booster. 20 of the 143 people have had no vaccinations whatsoever, and of those 2 had been hospitalized for COVID treatment. And we had 110 people test positive in the last 2 weeks of December. So by placement type, we have had 1 person in a correctional facility test positive, 13 people in host homes, 121 people in intermediate care facilities, 1 person in a mental health facility, 108 people in natural homes, 2 in a nursing home, 6 in out-of-state placements, 47 in residential habilitation, and 281 in supported living placements. So the 121 people in intermediate care facilities represent about 40% of people in ICFs. Of those 121 people, we have had 28 deaths. However, only 13 of those are confirmed as COVID deaths. So it's just a little under 11% of people in intermediate care facilities who contracted COVID who then had a confirmed COVID death. In natural homes, the 108 people represent almost 12% of people supported in natural homes. Of those, there have been 6 deaths, but only 5 are confirmed COVID deaths. So a little under 5% of people in natural homes who contracted COVID had a confirmed COVID death. In residential habilitation, the 47 people represent about 43% of people in residential habilitation placements. Of those, there were 3 people who died, but only 2 confirmed COVID deaths, representing just over 4% of people in residential habilitation who contracted COVID and had a confirmed COVID death. In supported living, the number is now at 281, which is about 29% of people in supported living who have contracted COVID. We've had 27 deaths among those people, but only 15 are confirmed COVID deaths, representing just a little over 5% of people in supported living who contracted COVID and had a confirmed COVID death. And so overall, of the people supported by DDA, it's about 23 to 24% of people have contracted COVID. There have been 68 deaths. Only 37 of these are confirmed COVID deaths, representing a little over 6% of people supported by DDA who contracted COVID and have had a confirmed COVID death. So by placement type, ultimately in December, we had 60 people in supported living, 42 people in natural homes, 4 in ICF, and 1 in residential habilitation who contracted COVID. And in January thus far, we have had 18 people in supported living, 4 in natural homes, 5 in residential habilitation, and 4 in ICFs. The outcomes for people have been generally much better than some of our previous outbreaks. In January, we had 1 person who required hospitalization. Interestingly, it was a person who had actually tested positive in December, been asymptomatic, completed their isolation period and became ill after that and required hospitalization. They are no longer in the hospital. We currently have no people in the hospital. Since the beginning of December, 8 people have been hospitalized, and there are currently none in the hospital. We did have 1 person who had COVID previously who died this month. The 2 seem quite unrelated. The person died from an underlying illness well over a year after recovering from COVID. But to date, of the people who have had COVID, we have had 68 people die. Of those, we are still awaiting confirmation from OCME regarding the specific cause of death for 15, and 16 have been confirmed as not COVID deaths. And so to date, we have had 37 confirmed COVID deaths. The last confirmed COVID death that the last confirmed COVID death that we had was in March of 2021. Among provider staff, we are still seeing a very high number of COVID infections. To date, there have been 974 provider staff who've tested positive. 60 of these staff have been reported by more than 1 provider agency, and we have had 10 staff die of COVID. That number has not changed for quite some time. Our vaccination rate, we did see some increase this week for the people we support. So it's at 83%. In host homes, it's now up to 94%. In ICFs, it is at 98%. In natural homes, it's at 67%. That had been stuck at 65% for quite some time, so any little increase is good. Residential habilitation is at 98%, and supported living is at 91%. Among our provider staff, vaccination rates are at 95%. And among DDS staff, the vaccination rate is at 94%. One note about vaccination rates. We have been reaching out to our provider agencies to encourage them to update the record regarding vaccinations, um, making sure, one, that when people are eligible for a booster, that they get a booster, and secondly, that information then be entered consistent with the instructions that were provided in MCIS so that we can accurately report on those numbers. How do our numbers compare with other systems across the country? How are we doing? Off the top of my head, I can't say. We had a meeting this week regarding Omicron, and it sounded pretty consistent amongst all the directors that were there. I will say that the one area that was discouraging to me was that the few states that were reporting much stronger numbers on getting people boosters. People were reporting the same thing, though, about really high infection rates and not as serious outcomes. But the specific numbers I don't recall, so I'd only be speculating if I answered that right now. So one other thing to keep in mind, as people may be aware, the mayor's order requiring that certain establishments require proof of vaccination in order for you to enter in the District of Columbia goes into effect tomorrow. And this will affect indoor food and drink establishments. So if you're going in to sit down to eat dinner inside, or a nightclub, breweries, wineries, fast food restaurants that have a seated option, will all require that you show an identification and proof of vaccination in order to enter and sit inside. Restaurants and other establishments can still allow for outdoor dining, not inviting this time of year perhaps, but they can allow for outdoor dining without the vaccination requirement. Proof of vaccination can be an electronic or a paper copy. So people might want to make a number of copies, or if you have a phone, take a picture and keep the picture on your phone. It also includes gyms, fitness studios, bowling alleys, movie theaters, any live entertainment venues that are indoors. Not included are, trying to see in there, frequently asked questions. I do recall what some of the things that are not included are church, any house of worship, grocery stores, retail stores, the kinds of places where when you go inside, you're moving around. Homeless shelters, human service facilities, healthcare facilities, pharmacies, farmers markets, law enforcement buildings. You can go to vaxdc at dc.gov, and you will see frequently asked questions that give lots of information about the implementation of these new requirements in the district. But what it means is that you'll either you can register your vaccination, and you can get information about that from the frequently asked questions. There's a way to do that electronically. You can have an electronic copy, or you can have a paper copy, or you can carry the card with you. I would encourage people who support folks to perhaps make a number of different cards so that, if a DSP is with them, the DSP may have a copy, the person can have a copy. And as I said, if people have phones, it says an electronic copy works as well. And just as a reminder, as every week, we do have guests here from DC Health who can answer questions regarding any of the current guidance from DC Health or questions regarding vaccinations. And as a reminder, if you have a question, make sure that you type it to everyone so that we will be able to see it. You can type the question in the chat. What impact will the Supreme Court ruling have on current mandates pertaining to the vaccine? None. So the Supreme Court ruling was about a federal regulation issued by the Department of Labor and about centers. There were two rulings, actually, and the one that gets all the play is the one where they ruled against the administration. And then they mention in passing that the administration, the Health and Human Services rule regarding the vaccine mandate for healthcare providers was upheld by the Supreme Court. Both of those were challenges to the federal government's authority to issue these kinds of mandates. One, they upheld the medical mandate, which is very similar to the mandate that that is being used regarding our Medicaid waiver providers, our healthcare providers in the district. And it's the state doing it. And so, you have state police powers are quite strong. The court didn't address that issue. And the other, the mayor's order that just went into effect requiring people to have vaccines to get into certain locations, not covered by that Supreme Court ruling. So that ruling really has no effect on the mayor's orders or DC health regulations that have been issued in the District of Columbia. Such a good question. Can a DSP have a picture of a person's vaccination card in their personal phone? They should probably not do that because that means that they will be they'll be out carrying around the person's health information with them outside of work. but you could make a copy that you have available, pick up every time you see the person. Has the mayor provided a deadline for healthcare workers to get a booster? Perhaps DC Health knows so far. I know that there's been discussion of this, but I'm not aware because I know that I'm not aware, first of all, of this even being included in the DC Health regulation regarding healthcare providers. First, the only place where I recall this requirement being included was um, the mayor's order that directed the city administrator to change the rules regarding DC government employees to eliminate the test out option for DC government employees and to require that DC government employees get boosters. The order says DC government employees and contractors, but it is not applying broadly to contractors. It's applying to contractors that work under the direct supervision of the district government, such as the guards in our buildings, or other contract staff who might work alongside of us. But my understanding is that's as far as that change in the sort of definition of fully vaccinated went. And if someone from DC Health knows more than that it's applying to healthcare workers, because I didn't think it was yet.
To the best of my knowledge, Director Reese, that is correct.
Can providers require their staff members to get boosters? Absolutely, yes. You are an employer and you can establish requirements for your staff. Prior mayor's orders have always been clear that whatever floor was being established by the mayor's order, that individual businesses could certainly go beyond that. Oh, this is a really good question these days, Nelson, because we are seeing people get exposed a lot to COVID given these high numbers. So if you're quarantining a person and they've been quarantined because of um, oh, it moved. So quarantining people supported, if they've already been quarantined because of a prior exposure, does their quarantine clock reset if a staff providing support during the quarantine tests positive? For example, a person quarantined and on day 10 of that quarantine, an asymptomatic staff then tests positive.
Hi, Director Reese, it's Nelson. So depending on the circumstances, if that person was, again, exposed on day 10 and it was a true exposure that met definition of exposure, then yes, that quarantine clock unfortunately will reset.
I think a number of day programs that reopened last year to in-person services have closed to in-person services in January to see where the current COVID wave goes. Is there any discussion about an Appendix K retainer payment for 2022? Retainer rates were included for 2022 in the most recent transmittal, but I don't think Day is approved to bill the retainer. That's absolutely right. They included retainer rates in the event there are authorized retainer payments, but you may recall that those retainer payments were authorized by legislation. So the chances of Congress passing something else anytime soon. That change was allowed because of specific language in the American Rescue Plan Act. And we have not heard of any action on establishing that or, extending that into calendar year 22. It is still early in the year, so we will see. But you're very correct. The Appendix K was the language was explicit in ending retainer payments December 31st, 2021. Do we have a sense of the operation capacity of day programs, especially in light of the current wave of COVID? Do we know how many are providing in-person or virtual services? I seem to recall DDS was surveying providers, and you are correct. We surveyed providers and shared that information. And I know that Shasta, who had done that survey, is not here today. I do recall sort of specifically about 4 providers who had notified us of pausing their in-person services. But we did have a specific number of day providers. I know we've provided that to service coordination. And so the best I could do now is just to say that Shasta can report on that when she's here next week. There has certainly been a pause by several providers on providing on maintaining their day programs, both about, concern for the health of the people who attend those programs, as well as staffing issues. As I said, we saw the numbers for DSPs this week went up quite significantly from last week. There were 59 new people who, direct support professionals, who were reported as testing positive just last week. Can someone provide guidance surrounding vaccine exemptions for provider employees? We haven't gotten an update on how DC Health will proceed. I'm not sure if someone can. We have provided updates here just in that last week. DC Health provided us with the numbers that they had to date as of last week. Asked that people please be patient as they go through the I can tell you what the numbers were as of last week. But essentially, they are moving through the exemption requests as quickly as they can. If a person has submitted an exemption request, they are eligible to continue working while that exemption request is pending. The mayor's order did not require, however, each provider certainly can require that the person test regularly while that exemption request is pending. There was still quite a few to get through. So for religious exemptions, as of last week, HRLA had 1,945 pending and had denied 11. Medical exemptions, there were 1,360 pending. 168 had been denied. 31 had been granted. And so, I guess the update is, from my understanding, unless there's someone from DC Health that can give more specific information, DC Health is working on them. They're doing them as quickly as they can. And while it is pending, the person is still eligible to work. And then it is to the discretion of each provider to require testing pending the outcome of that waiver request. Just so people are aware, folks can get a waiver if you wish to go to a restaurant or one of these other locations in the city that require a vaccination, but you've got to show proof that you applied for the waiver, and you have to show proof that you had a test the day that you're going to, that you got the test and have the results the day that you're seeking to go to one of those establishments. Is it possible for Shasta to send the day program survey data out to providers? Yes, she can do that, and I will ask her to do that when she returns on Monday. 0 religious exemptions have been granted by HRLA. Hold on one moment, because they report separately. For EMS. Oh, nope, that's true. 0 granted there. And they also report separately for, in all of district government, there was 1 religious exemption granted for district government employees. There have been 206 denied, 353 are pending at DCHR, and 242 are pending at DC Health. So to date, for all the different routes of seeking a religious exemption, apparently 1 has been granted. All right. Someone is reminding me I will not be speaking to Shasta about this on Monday because, like many of you, I will be recognizing Martin Luther King Jr.'s birthday on Monday. Why are providers being held accountable for providing employee booster status if boosters are not mandated? I would have to check with Shasta about the questions that we're asking about staff, but we started asking about, I mean, we are certainly pressing right now to get the data regarding the people that we support, but I'm not sure if booster status is on the report that Shasta has people fill out every 2 weeks. We started asking for that data before it was mandated. I think it's essential that the people supporting the people that we are all here to support be healthy. And one of the best ways for all of us to stay healthy, the recommendation from the CDC is that everyone over the age of 12 I think their recommendation is everyone over the age of 18 get a booster, and people over the age of 12 may get a booster. So I don't want to misspeak there, but they do. We are not asking for booster information, apparently. We're only asking vaccination count. So they have not been asking for provider staff booster information, but we have been asking for booster information regarding the people that we support. Providers are responsible for ensuring the health care of people that they're supporting. And routine health care right now would be ensuring that a person has gotten all of the necessary vaccinations to prevent COVID-19. And so we certainly would be asking that question. And we need to either improve the reporting of or the performance on ensuring that people we support have boosters. Because the percentage right now is, the percentage reported is extremely low. But like I say, that could be the reporting, and this is why you've been getting a fair amount of communication recently to update the information regarding whether people have received a booster. Because the data nationally is very clear that the outcomes for people, one, who are vaccinated are better, and who are boosted are even better. So people need to be current with their vaccination. And just as a reminder, the folks that we support in intermediate care facilities and residential habilitation placements have been eligible for a booster for 6 months now. It was last summer that they first opened the door to, that they first allowed for boosters. And when they first allowed it, it was for folks who were either had health issues or living in long-term care facilities. So at least ICFs have been eligible for quite some time. And as a reminder, vaccinations are widely available in the District of Columbia. When a parent or guardian, it says, denies that a person supported should not be vaccinated, and a provider issue is entered, how will the provider respond to that issue? What you'll notice is in the vaccination tab in MCIS, and I know there are folks from quality here who could either supplement or correct me here, but there is a vaccination tab in MCIS, And if someone checks no, there are some steps you need to take to ensure that the person has gotten adequate education about the vaccination. To identify what the barriers are, what their concern is, to make sure that they've been given information, and if necessary, to have them sign the declination. And so it would require all of that in order to ensure that we're taking all the steps we can to encourage people to provide for their health in the way that is currently recommended. Is it okay for day programs to require boosters as a condition of returning to in-person services? Would there be any issue with that requirement per DC, DDS or DC health policy? No, there's no problem with that. I think even in our day program guidance and subsequently, CMS has come out with guidance saying that providers can require a vaccination. Now, the only caution I'd have about saying that you require a booster is in going through to see if people were current in their vaccination, I notice that we have some people who are not yet due for a booster. So that person, until they are due for a booster, is considered fully vaccinated. So requiring a person to be fully vaccinated is a program decision that any day provider can make. It's then up to the person's team to identify where the person can get service, given the limitations on going to a particular provider. But yes, providers are allowed to implement a vaccine requirement or a testing requirement to attend their program. And it requires frequently checking up on the CDC's website to see what the current vaccination recommendations are, because it is now, as you may know, 5 months since your last Pfizer vaccine and you're eligible for a booster, 6 months since the last Moderna vaccine and you're eligible for a booster, and 2 months since Johnson & Johnson. And as people should be aware, the booster can be any. You can boost any of the vaccines with any of the vaccines. You can mix and match. If you have questions about that, please talk to your healthcare provider. Do residential providers have that same ability? Yes, they do. Now, if you are currently providing residential services to someone, they have all the rights of they're receiving a Medicaid service. So you're talking about terminating a service, that's a whole lot bigger lift, heavier lift. If you're talking about saying before you can come in, we need to see these things, you can put that limitation on people and it may limit who then decides to come to you. Very good. Thank you. Diane has included in the chat exactly what people need to do so that if they have an issue because of a person not being vaccinated, they can see how they can address that issue. And Nelson included, thank you. Nelson included a link that gives you the current information about who can get a booster. Oh, who should get a booster? Everyone 12 and older. So it is now anyone 12 and older who got Pfizer should get a booster. Anyone 18 and older who got Moderna, anyone 18 and older who got Johnson & Johnson. Oh, and Moderna is now 5 months, apparently.
That's correct, Director Reese. Both Moderna and Pfizer are now 5 months.
Oh, see, this is the challenge of trying to track whether people are current, how you keep your metrics up to date. So there's a very person-specific question here, and I would suggest talking to the person's team. It's about a person who needs sedation before they could get a shot. They've tried to sedate the person, but the person, it says, was still alert, so the vaccine couldn't be given. Please make sure you're talking to the person's IDT, their interdisciplinary team, about the challenges of the booster, or the challenges of giving the vaccination, and ways to overcome that. And I don't know if Dr. Bullock is here with us today, but I know that she has been dealing with this and she's been helping some folks with it. So if she's available to provide any comments on that, that would be helpful as well. Because I know she has talked about the challenge of some people who have anxiety about getting a shot and how to help them through that. And she and her wonderful team, she's got an amazing group of folks who are supporting her there at Georgetown, have been working with us on some of these issues. Jeez. So is DC Health and DDS aware that some DDS people supported have been turned away by DC psych hospitals if they refuse to take a COVID-19 test when they're being FD12'd? I am certainly not aware of that. I would expect there to be a serious reportable incident to that effect, and I haven't read any of those. We would certainly want to be aware. I expect DC Health would also want to be aware as the licensing agency for that hospital.
Good afternoon. This is Tembi from DC Health. We will follow up with this and get back to you as soon as possible. And we have a general email address, coronavirus.hai@dc.gov. If you could send us additional information or your contact details so we can follow up with you immediately after. Thank you.
Thank you. Could you type out that email address for us?
Yes, I can type that
There
out
it is, right
immediately.
there. It's there already. Thank you. So for folks who are on the phone who can't read the chat, it is coronavirus.hai@dc.gov. So it doesn't seem we have more questions. For whatever reason, this morning, I was thinking back to when we started these discussions quite some time ago. And I was more mindful at that time, early on in this, to really express my thanks to the providers who are on the front lines of this. As I think about how exhausting this is, it's just exponentially more so for the folks who are having to deal in the community on the front lines every single day. And I probably don't say enough how much we appreciate how hard folks are working to continue to provide the quality supports that they're providing for the people supported by DDS. So keep up this good work. I'm hoping that we're learning a lot through this and slowly developing an even stronger system. So thank you so much for your commitment to people. I know, what we see here in DC, but this is also something I hear from directors across the country about what a strain this is putting on an already strained system. So thank you for all your hard work. Enjoy your long weekend, and we will talk with everyone again next week.